Welcome to Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Welcome to Doc Discussions. This is Jason Edwards, and I'm here again with my good friend, Lisa Ryan, a pediatrician. Lisa, how you doing today?
Pretty good. Thanks for having me.
Good. Yeah, there was a really interesting article that came out in the New York Times Magazine entitled, "Have We Been Thinking About ADHD All Wrong?" And it was published on April 13th, 2025. Really interesting article that kind of explores a lot of things with ADHD. And some of the key concepts of the article were that there was a record high diagnosis of ADHD, up to 15% in American adolescents, 23% in boys. And it really, I think, kind of raises some interesting questions. And I was just wanting to kind of get your take on it.
Yeah, there are a lot of interesting points in it. And, just to start at the beginning, like what you said about how we're seeing the diagnoses increase. And it's hard to know where that's coming from. And I agree. I am certainly seeing far more people who are wanting to be evaluated for ADHD. And I'm certainly making far more diagnoses than I did earlier in my career. And again, it kind of brings up the point, is it because it's something we're recognizing more, or is it truly more of an issue?
Yeah.
And the article, I mean, I don't know that it really came up with a good reason for that, but just kind of pointed out that we are seeing some of those changes.
Yeah. And I think we're kind of in this era of this high information era where you can, there's never a lack of information. It's just trying to figure out what's right information. And I think this article has generated a lot of discussion. And I think that's, and within discussion, you're going to have people who give accurate data, and you're going to have people who get inaccurate things, and people going to tell anecdotal stories, which are, have some value, but are not super useful. But I think the more discussion we have, the better it is, because over time we can kind of find the truth better or closer to the truth. And so I was happy to see a lot of discourse on something like this. One of the things that stuck out to me, they mentioned this MTA study. It's called the Multimodal Treatment and Attention Deficit Hyperactivity Disorder Study. And what they found was that the short-term effects of the Ritalin and Adderall were definitely apparent up to like 14 months. But at 36 months, it appeared that the children who were on this were performing no better than children on other behavioral interventions, or no intervention at all. And so I was just going to get your thoughts on that.
Yeah, that's probably the point in the article where I was kind of like, oh, wait, what, really?
Yeah.
Because that's not what I see in the office.
Yeah.
So that was kind of the first point in the article where I was like, oh, wait a minute. This isn't what I was expecting. Because, I do treat ADHD, and we do have people on stimulants, and we do see them, back for many years needing them more. And just finding use from them. So I've never seen someone have a stimulant work and then just kind of not work, but also have them not needed.
Yeah.
Like we do run into points, obviously, where the stimulant isn't doing the same job anymore, and then we have to make some changes. Mm-hmm. But I've never seen someone just kind of need it and then not need it in such a short period of time.
Yeah. So when I kind of delved into this, I didn't do like the deepest dive, but what I found is that you had a lot of people online kind of giving anecdotal stories, like it worked for me, or like my neighbor tried it and didn't have a good experience with it, and things like that. And I don't like discount that kind of stuff. Like there's some value in those kinds of things. Experts weighed in and were kind of saying like, hey, like that was a weak study. And so I think when you're seeking truth, you want to try to find like, well, what's the best evidence? And I think we did this in one of our other podcasts. So I typed in what's the strongest evidence? And there was actually a meta-analysis which is a culmination of randomized controlled trials kind of typically regarded as one of the strongest forms of evidence. And they found something similar. Now, I didn't, you've read scientific articles, I've read scientific articles, and there's always strengths and weaknesses of each.
Sure.
And I didn't go into that. But are there any other strategies in treating patients who have ADHD aside from like these stimulants?
So, I mean, I think we should even take a step backwards and talk just a little bit about the diagnosis of ADHD.
Yeah. So that's a good idea.
Sure. So, it's a tough diagnosis to make, and I always tell my patients, I wish I had a blood test. Like I wish I had, or something I can observe on you that makes sure that we know this is ADHD, but we just don't have any of that. And the article talked a little bit about biomarker studies that, never panned out. So what we have instead is really just observations and subjective data. So we give questionnaires, they're called Vanderbilt scales, to parents. We give them to teachers. I always tell everyone to get as many back as you can. And then they send them back and we score them and we look through them. And they ask you like 9 questions about inattention. They ask you 9 questions about hyperactivity. And if you answer yes, more often than not, to 6 of those on either of those categories, then that's considered positive and it's considered a diagnosis. There's a couple of other things, but those are kind of the big ones. Mm-hmm. So what I've decided over the years to do in my practice is I go by those. If it's not diagnostic on those, I'm like, no, I'm not going to treat you.
Sure.
Because the other thing we've seen is it's actually somewhat easy to get this diagnosis. Like you can walk into, there's certain places who will say they will test you for ADHD and report back. And I've seen strange reports come back that are almost always positive on patients who I've seen as negative. So it's really hard to kind of make the diagnosis from that standpoint already. And then you have other things that also cause inattention. Is this an anxious kid? Is this a depressed kid? Is this someone who's being bullied? Is this someone with a learning disorder? So it's really important also to kind of like wade through all of those things first before you even come back to the ADHD as the cause, and really make sure that if you do find there's a learning disorder or you think there might be, that you've fully evaluated that first. So by the time you've gotten back to ADHD and you've decided to treat, most of the time, a stimulant is going to be involved, in my experience. Mm-hmm. Depending on the age of the kid and sort of the degree of symptoms and how impairing it is, we'll send kids for counseling. And they can work on, coming up with coping strategies.
Developing techniques to kind of get through these.
Exactly. And there's an OT clinic down at WashU who really focuses only on like executive functioning skills and really kind of teaching these kids how to get through their day, how to keep things organized and all that. So I think there's a huge component to that. But, and that might help a kid for a while, but typically over the course of the years, you kind of hit a point where it's just too much. School's getting harder. There's too much going on. I need more help. And that's often where the stimulant comes in.
Okay.
There's some non-stimulant medicines, and I kind of use those in conjunction with stimulants. I've also never been able to have a kid be fully successful on a non-stimulant med either.
Yeah.
So that's kind of where the diagnosis and then the treatment comes in.
Yeah, so it's not an objective diagnosis where it's like you do some test and you get a yes or no. Mm-hmm. It's subjective, meaning a person has to look at all these things and make the decision, yes or no. And these tests help,
right?
And then some people will criticize the tests,
sure.
And then some people will, and I think it's always okay to revisit some of these things. One thing I think about a lot are biases. Mm-hmm. I have biases. Everybody has biases based off of your own life experiences can help you make decisions, but they can also kind of work against you too.
Right.
And I'm not saying, first of all, everybody has biases. If you're listening, you have biases. If you're a school teacher and who most of them are salt of the earth, God bless them. Mm-hmm. But if you have a kid who's a little bit on the rambunctious side and he's impeding your objective of teaching the class, like taking a stimulant like this will make you sit in the chair better and help you focus better. So there is some incentive for the teacher and the parent who's dealing with a kind of a wild kid or a hyperactive kid it makes their life easier if they're on it.
For sure.
And sometimes I wonder, like, that has to play into it some. They're not, parents aren't bad people for having their kids on this. Teachers aren't bad for recommending it. But sometimes I wonder if that moves the needle some as well.
A lot of the times that is sort of how the kid gets into my office. And I guess I should preface, so I'm married to a middle school teacher. Yeah. So he teaches 8th grade. And so we have lots of discussions about ADHD over our dinner table. And he will tell you, I can tell who needs to be on meds and I can tell when they did not take them.
Yeah.
And so, but there's actually a law that school professionals are not allowed to diagnose per se. So they're allowed to talk to a parent and be like, hey, your kid's having some problems. He can't sit in his seat. He's doing these things. They can kind of allude to, hey, maybe you should go see your doctor. But they're not supposed to be able to say, hey, your kid has ADHD, go get a diagnosis.
I did not know that.
Yeah, that's how it's supposed to be. I mean, I get variants of that in my office.
Yeah.
But so they're allowed to, sort of walk around it. But yeah, sure. You can see, I mean, I had a kid we did an evaluation on recently, and their parents were like, we're here because the school said we had to be, and his teacher thinks he has problems and needs meds now. And we don't think so. And you could tell when the scores came back, the teachers was, off the charts, everything was positive, and the parents were not so. But with that particular kid too, we also delve a little bit deeper, and he seemed to have an anxiety diagnosis.
Yeah.
So we're actually focusing on anxiety, and we've started some treatments there, and we're already seeing some improvements.
Yeah.
So if we can get the right diagnosis and the right treatment, sometimes you'll see those school problems kind of come around as well.
Statistically, I think that we call it a kappa analysis when you analyze, when you would compare the difference between the concordance between the parents' score and the teacher's score, or somebody else's.
Right.
Are they typically concordant, or are they typically different?
They're usually pretty close.
Okay.
I mean, this was kind of a more unusual point where the schools were really
nothing's perfect, right?
Right.
Yeah.
But you can usually, from talking to the parent and seeing what the teachers write and what the parents write, kind of figure that out too. But to your other point about just kind of wanting your kid to sit in a chair, the other part of the ADHD diagnosis is you have to have this impairment both at home and at school. It can't just be in one place.
Okay.
And parents will often talk to me about, he does all of these things, but it doesn't bother me so much.
Yeah.
And it's like, well, but is that, because you're willing to put up with it and someone else isn't? Sure. And, we'll talk sometimes too about, will that cause problems with friend relationships? Are you not going to get picked up for the pickup basketball game because I throw you the ball and you're always looking in the other direction?
Yeah.
So I think even this ability to kind of have a kid sort of be in a calmer place is a benefit for him moving forward.
Yeah.
And I'll always tell the kids, I'm like, this isn't a do well in school medicine. This is really a do well in life medicine. Mm-hmm. We want you to be the best you in all of these situations.
Yeah. So it does seem kind of odd that, a child's revved up and having a tough time paying attention, and then they're treating it with a stimulant. What are your thoughts on that?
Yeah, I don't know that anyone truly understands how the stimulant works to help. Sort of the best way I've seen it explained is that a child who has ADHD is basically telling his brain, hey, focus on the teacher, focus on the teacher, focus on the teacher. And their brain is like me, no, look over here, look over here, look over here. And when they take the stimulant, they feel that look over here part of the brain kind of calms down so that they're able to focus on what they want to focus on.
Okay.
So that's the best way I've heard a kid, kind of explain what the medicine does when they're on it. But, I think one of these other things with the article, when it was talking about how this isn't necessarily a disease process, might stem from that in part that we don't truly understand how these medicines work. So it's difficult to say, hey, you have a disease and we're going to give you this medicine for it when we aren't really sure exactly what we're fixing per se.
Yeah.
And so I think that was in part how this article is able to in some ways make this conclusion that it's not really a disease, and instead is due much more to the surroundings. So I think if we truly understood more about how these stimulants helped kids, that would be a big deal.
Lisa, I really appreciate you putting it like that, because a lot of things in medicine we don't fully understand. Mm-hmm. Most things we don't fully understand. But there's, our egos make us hesitate to say that, we don't fully understand that. And it takes some humility to say that. But I do appreciate when people, accurately say, hey, there's a lot that's unknown here. We know that this appears to help people. It's an evolving process. I do think the discussion is positive, so we can continue to optimize this. And whether they revisit the diagnosis criteria or focus on fine-tuning some of the medications, or adding adjuvants to it, such as exercise, diet, neurofeedback, other things. I think that's the way forward, is to have good, honest, and open conversation. And so I appreciate your candor.
You bet.
One of the things that, as I was going into it, I thought, well, what are the potential long-term adverse effects? I don't think anybody argues that if you take the medication that it helps initially, and to say, well, if it seems like maybe, it's questionable, but maybe there's like long-term, it's not as good, or maybe it is, you could argue that. But like, what are the downsides? I actually found that kind of two things, the downside, long-term downsides and upsides. The two things I found were there was an increase in psychosis of about 4%. So pretty small, but not great.
Right, yeah.
But the substance abuse went down about 50%. And so I think like, you don't want either, obviously, but in the real world, the 50% is huge, for substance abuse. Substance abuse will derail your life. And they thought it was because of impulse control. And so I thought, that there's a negative and a positive there.
Sure. And I also wonder if that's partly self-medicating, like what
That's
can
exactly
I do
what I thought.
to kind of get myself in a better place.
Yeah. If you were kind of pretty revved up by nature, and maybe smoking a joint or having a beer kind of took the edge off. I mean, a lot of substance abuse is that.
Right.
And then I read a post that kind of actually resonated with me. It said, I noticed this was an issue for me. And ever since I was a kid, I would go run every morning and then go to school. And I don't work out in the morning anymore, but I used to. And it definitely relaxes you through the day. I mean, it definitely settles you down. And I thought, and I actually didn't look to see if there's any clinical trials, but I wouldn't be shocked if exercise was helpful with this. Shocker, exercise is good, right?
Right there. Good for everything. Well, and that's the part of the article we haven't talked about yet. We're saying that, it gets into eventually saying that ADHD is really environmental, and it depends on what environment you're in. And, oftentimes when I'm talking with parents about whether we should start medication or not, they always ask, is he going to be on this forever? And, my answer is usually that probably not. I mean, we never know.
Yeah.
But, there's a good amount of kids who can, they learn to control it to some extent. But more importantly, you reach a point in time where you are able to control your day. Where, a kid with ADHD is probably not going to be drawn towards a job where he sits in a cubicle all day. Yeah. He'll be a forest ranger, he'll be out, he'll be able to do something that, works towards his interests and towards his needs. And maybe while doing that, he won't have to take the medicine quite as much. Yeah.
They make a great point on touching on that, as people kind of find their lane. And usually that's how they kind of come off of it. Whether it's exercising or finding a vocation or a way they spend their life that helps with that.
Right.
And then, it goes a lot into like, and what you talked about is it something that's inside you? Is it something, is it an external factor? I think a lot of life, it's always more complex than you think, a lot of disease. And people will say like the genetics, like cock the hammer and the environment pulls the trigger.
Sure.
It's a little bit of both.
Yeah.
Without sounding like a politician, but it's a little bit of both. And I think, you can't change the genes that you have, but you can certainly always optimize your environment.
Sure.
Now, truth be told, I'm sure when you're talking to, when I'm talking to patients about things, sometimes you meet new people every day. So you get a good sense of people and what they can do and what their capacities are. And there are a lot of probably non-medical things you could do, but people only have so much capacity, and some people have more than others.
Right.
And so to implement an exercise regimen in a child or something like that, or to completely change your diet or to watch less TV. Those things take effort and energy, and it's tough to do for sure.
Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Well, and you do sometimes see the people who are coming in for kind of the quick fix per se.
Yeah.
I do get a couple of, high school juniors being like, he tried to take the ACT and it was super hard. We think he has ADHD. You need to evaluate.
Yeah.
And so I've kind of put an age limit in my practice as to, once you reach a certain age and you think you have ADHD, you should be evaluated by a psychiatrist or somebody else
wise.
To kind of like weed some of that out. But you do see some of that sometimes, or the kids who haven't needed it for a long time and then suddenly want it because college is a little bit harder. And it's sort of tough to know what to do about those kinds of things. Like, we diagnosed you in the past, you took it for a couple of years and then you did really well. And now in this new environment, you need it again. And I usually advocate for sort of a new evaluation, which, I guess reasonably so. Sometimes the parents balk at a little bit.
Yeah. Well, I mean, to be totally honest, like, the first time I really, maybe it was, I was aware of it for the first time or not, but the first time I really saw, a lot of people on Ritalin and Adderall was medical school.
Sure.
And did you have a similar experience?
A little bit, and there was actually a New York Times article about that several years ago.
Okay.
And it was talking about how the presence of Adderall is kind of raising the bar, because you do have these group of ADHD kids who need it and they need it to get everything done. But a kid who didn't have ADHD, or a college kid who doesn't have ADHD and takes it, is now going to be able to stay awake longer, is now going to be able to study longer. And in some ways, you're now raising the bar for everybody.
It's no doubt about it. It's a performance enhancer. There's no doubt about it. I think I wouldn't recommend it.
Never tried it.
but I think it's not good for your health. It's probably, if you don't need it. But that's where I kind of saw some widespread use, and I'm sure in undergrad it was there too.
Yeah, I mean, we monitor our prescriptions really carefully. I mean, like, to the point where I think it's annoying for others, but I mean, that's what you've got to do. And I have had a few, maybe like 2-3 patients over the years who it's been like, wait a minute, I don't think you're taking this. I think you're doing something else with it.
Yeah. People, take it like they drink coffee, before they study or something like that, or sell it to a friend or something like that.
Yeah.
And, but to me, the last time I looked before this article, it was about 13% in boys. And to see that it had bumped up to 23% by the time you're 17 that you've used it once, boy, does that seem high to you?
I mean, yeah, it does. And I think, there's just kind of so much that goes into it, like making, like, are these kids who are just kind of getting it somewhere? Are these providers who are making these diagnoses that aren't being careful and are, handing out these meds easily? Are they not being followed long term? I mean, there's certainly something that happens to middle school boys. They're my own middle school boy. We hear what happens in his classroom sometime, and some of the things he's doing all of a sudden that we're like, you never did this before. Like,
what do you mean though? Can we double click on that? Not with your son.
No,
just
but
middle school boys in general.
There's just a lot of I guess
like silliness.
Just silliness.
Yeah.
Just not, these kids who used to be able to sit still in a classroom suddenly are not. Like I've had some conversations with our middle school principals because of my kid.
Yeah.
But, and I'm like telling them, I'm like, I'm really embarrassed. I'm so sorry he's doing this. I don't know where this came from. And the response I get is, this is what happens in middle school.
Yeah.
They're pushing boundaries. They're trying to find who they are. They're showing off for their friends. They want to be the popular kid. And that's kind of where some of these personality changes happen.
Yeah.
And, could this be viewed as sort of ADHD or behavior problems? And that's why it comes up. Maybe that's part of it.
Yeah. So as somebody who's a complete amateur, like, what do I know about peds? Nothing. But to me, I think, you have like this bell curve, the concept of a bell curve, and, the 50th percentiles in the middle. And, I think there's this normal kind of distribution of behavior, and then on the fringes you have like some disease. And I think some of the normal folks are kind of getting diagnosed with ADHD, what I would consider kind of a normal ornery boy, because boys are, they're knuckleheads, they're rowdy. There's plenty of literature on this. School is not really made for boys. I mean, they're not great at sitting in a chair and listening to things, not nearly as good as girls.
Sure.
And there's all sorts of research on that, and that's a whole other topic. But I mean, this seems to affect boys a lot more than girls. And sometimes I wonder, if, to me, exercise seems like a good option to try to take the wind out of their sails. Now, maybe they don't pay attention as good or not, but something to take the edge off so they're not so amped up.
And that's part of the idea behind recess, right?
Yeah.
Like we give elementary kids several recesses a day. And there's a lot about, why are we punishing kids by taking recess away when we should actually be getting them out there more? And in middle school, you don't really have recess. You've got your lunchtime. And if you finish your lunch fast enough, if you inhale it in 5 minutes, then you might be able to go outside and play a little bit of basketball for, like 20 or something.
And maybe you have gym class, maybe not.
Yeah. So there's certainly, and I think that, and teachers know this, and, you'll find a lot more sort of alternative seating, like some of them will have like the bouncy balls that you can sit on, or a futon you can sit on, or a place that's not in front of a desk.
Yeah.
But, there's just a lot of changes at that time. And are there people who are misdiagnosed? I'm sure there definitely are.
Yeah.
But, I think that's part of just kind of being careful about making the diagnosis, and really, really closely following is just really important.
What's your husband think about the boys as a school teacher? What's he think? What's a school teacher think about this?
Well, I mean, he's the one who, like when my child gets the phone call from the teacher and all of that, I'll be like, okay, this is new to us. Our other ones didn't do this, but he'll be like, yeah, this is what they do, or they have this crazy language they all talk, which I don't understand, and this is just exactly, and this is just kind of what they do. So he'll tell you that there's a big change between like 7th and 8th grade, and a lot of it, is just sort of finding your place. But like this morning as he was heading off to school, he's like, I'm going to deal with the monsters. Yeah. So
yeah, I don't know if this is good or bad. I don't, if I see a young boy who's a little bit rowdy, I don't hate it. I don't hate it. I like to see a kid with a little bit of pizzazz, maybe that's framing it too nicely, but I don't hate somebody who's testing the boundaries a little bit.
Sure.
But if it can get, to be too much,
right?
Or they don't know when like they've kind of crossed the line and they need to rein it in,
right? And I think that's what you're seeing in the classroom. And I'll see some of my high school kids will come back and be like, I'm not taking my meds. I don't want to take them anymore. Yeah. And I'll be like, well, why not? And they say it in different ways, but essentially what they're saying is, I used to be the class clown and now I'm not.
Okay.
And I like being that person that everyone looks to and everyone laughs at and everyone thinks is really funny. And you've taken that away from me.
Yeah.
And that's a hard thing. I always tell them, we're not going to take away your you-ness. That's not, you're still going to be you, but we just need to tone it down so that you can be a part of the society, whether it be in your classroom or wherever else.
Yeah.
And just trying to, explain to them sort of these grades of behavior and what we can accept and what we can't is sometimes really difficult for them to understand.
Lisa, this is a super complex matter. Mm-hmm. My instinct is a lot of people, read these articles and don't have, much, like me, you don't have a lot of experience with it and you form strong opinions. Mm-hmm. And then you kind of hear from people who are in the trenches, mm-hmm. Which I would say is the pediatricians and the school teachers. And it's nice to have that nuanced perspective to kind of, see the whole issue in totality. And so I really appreciate you coming in and adding that context.
Sure. My pleasure.
Yeah.
Good to see you again.
Thanks so much.
All right.
Join us next time for Doc Discussions with Dr. Jason Edwards. It's medicine for your body, mind, and spirit.